Welcome. We'll start with the Yojana August 2018 summary. Now this section talks about social empowerment. If we look onto the social empowerment issues, it's mainly the scheduled caste, scheduled tribe, Safaikarmacharies, then you have the tribal groups, you have the manual scavengers, the disabled and the old age people. So that would be the focus for our today's class. We'll be covering all these topics today in detail. Now there is a famous saying, human mind is like a parachute. It works well only when it is open. So similarly, a society can progress well only when all the sections of the society are uplifted and they work together. Therefore, empowering each and every section of the society becomes very, very important. So let's start with understanding what are the major elements that we would be talking about. Across the lectures, we will be coming across some of the major ministries, which is major part for your prelims examination. So which department or which act, which policy comes under which ministry. So that also would be something that we would be covering in the lecture. Now, as we said, empowering is strengthening a person so that he can perform his day-to-day life, live a life of self-respect and could attain freedom from any kind of biasness, be it a caste biasness, gender biasness or any other biasness. So empowering the various sections of the society would be our foremost idea today. So let's start with scheduled caste. So for that we have first of all the various scholarship programs for the post-metric and the metric students. This has been started since 1944 and is still going on. Now the population, in terms of population, we say nearly 16.6% of the total population is scheduled caste. No enumeration has been done for OBC. It was only by the Mandal Commission and later by the NSSO that determined or estimated the population of the OBC in India. We have a significant population for the senior citizens. So we'll be talking about each of those separately today. Now there is a scheduled caste sub-plan that has been released, and that is that's the new name for the existing policy, that was the allocation for the welfare of scheduled caste, and this was a concept under the special component plan. So you had various plan resources that were flowing into the various funds that was going into this, and finally you had the physical, the financial and the economic outcome that was derived into the various sections. On this basis, you had the Pradhan Mantri Adarsh Gram Yojana. This talked about developing model villages. So each member of parliament would be taking care of some of the villages and would develop those villages. So this is a kind of integrated part, mainly in the areas where you have a scheduled caste majority that's been seen. You have a similar fund that is for the backward classes. It's under the name of National Backward Class Financial and Development Corporation. Then we talk about the social defense. Under social defense, we talk about the Rashtriya Yojana, that's mainly for the old age and those living with assisted devices. So senior citizens below poverty line living with assisted devices are being given priority and the various equipments under the Rashtriya Yojana. Then a very important focus is rehabilitation of the manual scavenging. So we are trying to eradicate the manual scavenging, and the 150th birth anniversary of Mahatma Gandhi is considered to be a landmark year where we are trying to achieve this goal for rehabilitating the manual scavengers. The idea would be recognition of prior learning. That's the idea under skill development. We call it as RPL. So whatever skill they have besides this would be used, and that skill would be further enhanced and developed so that they can have a kind of healthy and good livelihood for themselves. Similarly, we talked about the backward classes, we talked about the Safaikarmacharies and the scheduled caste development funds. So these are the three funds that are working with the finance department corporation. Then you have a special center for the under the name of Dr. Ambedkar International Center that has been established. It has been inaugurated in Delhi in 2017 in lieu to develop the weaker sections. We have successive governments that have come up in India. Each government had its own ideas, its own methodology. Later on, there were banking systems that were made strong. Concessional loans were given, credit facilities were given to these sections, the three sections that we talked about, the backward classes, the scheduled caste and the Safaikarmacharies. And then you have the specific role of the microfinancing institutes. Under this, we cannot rule out the importance of MUDRA Yojana. So that's basically providing credit facility and microfinancing facilities to small persons who want to start their business, or small households who want to start their business. Similarly, we talk about the Pradhan Mantri Jan Dhan Yojana, that's aiming at financial inclusion. When we talk about financial inclusion, there are two sides, the supply side and the demand side. So on the supply side, we have the timing, the cumbersome process, the process of activation, the process and the methodology under which you can basically open up an account. So that's all the supply side. On the demand side, it's poor literacy level, higher level of poverty, low levels of income, which are constraints on the demand side. So there are constraints both on the demand side and the supply side, and we need to take into account how to work around those. So some of the challenges that have been identified are the risk from the vendor sides, the dormant accounts, the inadequate awareness level, low level of literacy, low income levels, poor saving habits of an individual, the delay in the recovery levels. So all those are challenges for the financial inclusion schemes like a Jan Dhan Yojana scheme. So we have the separate financial inclusion programs, the first of which is the National Scheduled Caste Finance and Development Corporation. It was set up in '89. Similarly, you have the Tribal Finance and Development Corporation in 2001. So these corporations become important. The idea is it would be providing empowerment to communities living below the double poverty line. So that's one of the major ideas that it talk about, providing loan, providing vocational education, providing training, microfinancing, credit facilities to an individual. So scheduled tribe we talked about, it started in 2001 with the similar ideas, and the rate of interest would vary. So it would be 6% up to 5 lakhs and 8% up to 10 lakh. Above 10 lakh it would be 10% in the case of Adivasi Mahila Sashaktikarana Yojana. So basically promoting the tribal women for development or empowerment is the main idea under this scheme. So the interest rates have been kept at a lower level to promote more and more empowerment opportunity. Similarly, you have the Safaikarmacharies Finance and Development Corporation. It was established in 1997. And it has a share capital of nearly 600 crores. So that's again an important section that we need to understand. Similarly, for the backward classes, you had it started in 1992. So in which years these were started are important. Now this falls under the aegis of Ministry of Social Justice and Empowerment. So again, as we said, which ministry is important or takes into account or looks into it is important. So here it is Ministry of Social Justice and Empowerment. Then you have the Minorities Finance Development Corporation, again important. So far till 2014, the minority communities were Muslims, Christians, Sikhs, Buddhists and Parsis. After 2014, Jain community has also been included in the minority community. So this started with 1994. Then you have the Handicap Finance Development Corporation. This started in 97 with a capital of 4,000 crore, and the idea was providing the benefits to the persons with disability or the Divyang. So that was the basic idea under this. The next is Rashtriya Mahila Kosh. Important, it falls under the Ministry of Women and Child Development. So not under the Ministry of Social Justice and Empowerment, but under the Ministry of Women and Child Development. Again, looking for microfinancing options. For the Rashtriya Mahila Kosh, you also have the loan programs laid down under the MUDRA Yojana. You have the Stand Up India scheme that talks about the greenfield projects, providing nearly 10,000 crores for the next 5 years for the development of small entrepreneurs in India. Similarly, you have the Venture Capital Fund scheme. This was launched by Ministry of Social Justice, and it again aims to promote entrepreneurship among scheduled castes by providing concessional finances. You have a Credit Enhancement Guarantee Scheme released under the Union Budget of 2014-15 with a sum of nearly 200 crores aiming at credit enhancement facilities for young entrepreneurs. The Jan Dhan scheme we already talked about. Now what are the social challenges or the social changes that should come up for scheduled caste and scheduled tribes? So you have the discrimination laws that should be taken into account, giving them proper safeguards, providing them protection for the land, for the habitation, providing them scholarship, good education opportunities, increasing the level of literacy are some of the major issues that we need to tackle about. Then we talk about the education participation. So we focus on the gross enrollment ratio, the enrollment ratios in higher education in India, and those are something that we talk about. So you have a kind of social perspective that has been released. The study conducted by Pratham in line with Niti Aayog talks about self-employed entrepreneurships, and these self-employed entrepreneurships are on a rise in urban atmosphere, so that becomes really important. We have a global entrepreneurship monitor report that shows an increase in the entrepreneurial intentions in India, and nearly 44% of the adults see good opportunity to start a business, and 44 perceive as capabilities to start the business. So definitely India has a huge young potential, which we talk about under Skill India, which has entrepreneurship potential and their intentions to start an entrepreneurship. However, the challenges include lack of education, lack of proper procedural methods, administrative loopholes, shortage of finance, inadequate training, and post 1990s the economic reforms led to rise in the Dalit entrepreneurships in India, but still the number of the private owned entrepreneurships and the employment generated under this was significantly low. So those are some of the things that we need to address. Now when we talk about the entrepreneurship, the initiatives focus on increasing awareness, bringing in more training for them, increasing collaboration with other organizations, and talking about the regional indexes for research and development. So based on the regional needs, you should have more and more research and development in the specific regions. The Startup India project we already talked about, where we aim to promote more loan to the students. We talk about the Startup Village Entrepreneurship program. This focuses only on village entrepreneurship, motivating the young rural youngsters to work around it. Then we talk about differentially abled people, that's the Divyang or the people with disability. So having them the various devices, the assisted devices is one of the important things. Then the studies show the locomotor disorders, the hearing impairments and the visual impairments, the rate that has been provided. Then we also talk about, for the first time you had the cochlear implant that has been provided, and this program was released in 2014 for hearing disabilities. All the assisted devices that are being provided should be suitable and low cost. So technology becomes a forefront, bringing in technology to reduce the rate and provide best facility to the maximum masses. Then we also talk about training specific number of people, around 200 people every year for 5 years, so that the font and the teaching should come into being. So educating the disabled is one of the major ideas. Then we are also talking about the Accessible India campaign launched in 2015 that talks about the persons with disability to have or to be able to live in the environment, get good education and make them familiar with ICT or the information and communication systems. So for that, the awareness has been launched at different states. So it's at the individual level where they have a self-respect, at the family level where they get family support, at the societal level where there is awareness, social support, and then at the national level where you have various programs and policies that are implemented. The next is the various initiatives by the government for the welfare of the tribal groups. So you have the Forest Dweller Act 2006 that talks about the right to the land in the forest area, and these rights would be recorded. They would have the right to hold and live in the forest area, specifically the primitive groups. Then monitoring the fund for the tribal development. So special assistance to the tribal sub-plan is one of the major ideas. Providing provision under Article 275 of the Constitution of India to enable them to meet the developmental cost, and providing minimum support price for minor forest producers that they generate. So those are some of the specific developments for the tribal sector. Then we focus on the particularly vulnerable tribal groups, which we call as PVTGs. Now for their development, we have come up with specifically identified regions of the PVTGs, working around the provisions for housing, distribution of basic amenities, land development and agricultural development for them has been one of the major limelights. Similarly, when it comes to women empowerment, we have numerous schemes. The first and the foremost is the Beti Bachao Beti Padhao Abhiyan that has been implemented in the lieu of declining child sex ratio. Similarly, you have the Pradhan Mantri Matru Bandhan Yojana, that's mainly for the health care for the lactating and pregnant women. Then you have the Ujjwala Yojana that talks about rehabilitation and rescue against the prevention of trafficking. You have schemes of one-stop center and women helpline that have been started. Similarly, gender budgeting scheme, a very important concept. You already had this question in the prelims 2018. Again, this becomes a very important section for your mains. So what is gender budgeting? So we are trying to implement tools. Basically, the idea is to mainstream the gender perspective across the various stages to plan, budget and implement the various programs and the policy objectives. When it comes to old age, living a life of dignity, so age management techniques become very important. One of the recent studies said that with the aging, if the mental activities are more, the neurons sprout out and then they interact with new dendrites, and this makes them feel much more younger or decreases the pace of aging. So that's one of the major ideas that we talk about. We have various theories in line to it that talk about this. So we have the list here, you can check that out in the handouts. The idea is to improve the quality of life, give them a life of self-respect, more cooperation from their family members, bring them income security, insurance for them, bring them the basic amenities of food, medicine and shelter, and also kind of medical services for them. So integration of the various services and a life of self-respect is something which is very important with people with old age or the geriatric population that we talk about. Then you have the various provisions for social justice. So you have the fundamental rights, you have the DPSPs, we won't be discussing those. So those are just direct the articles and the content of the article that you have to memorize. It's really important. You can substantiate your answers with those. So you have the major fundamental rights, directive principles of state policy, and you have the various articles that talk about safeguarding, that talk about social justice, safeguarding the minorities, SCs STs. So all those become an important section to supplement your answers with. Similarly, there are articles that talk about political safeguarding and service safeguarding. Then there are some other articles that talk about the various commissions that have been appointed for SCs STs, women and so on. Now some of the schemes for the migrant population. Migration has been off and on an important issue. For example, you have the Bangladesh enclave region, you have the grants in aid in Tripura to the Mizoram people, then you have the refugees coming in India, the region of Pakistan occupied Kashmir. So those are some of the areas where you need to provide special assistance. Similarly, providing assistance to the deceased person who has died in the anti-Sikh riots, providing assistance to victims of terrorists, the violence terrorists and the other victims, the civilian victims. So all this becomes the responsibility of the government. Through the political intervention also, we can basically check out the empowerment issues. So checking on the issues of hunger, want, deprivation are some of the issues that we need to check about by political intervention. For the marginalized group, we have certain sections, like we say 7 out of the 10 people live in rural areas in India. So uplifting the rural area becomes important. Similarly, Mahatma Gandhi talked about Gram Swaraj, or developing the rural areas of India, bringing them self-independence and self-respect. So those are some of the basic ideas in line with which we had the 73rd constitutional amendment that talked about Panchayati Raj and the developments with Panchayati Raj. Similarly, the Panchayati Raj institutes focus on the marginalized section, 1/3 representation to the women, but there are still challenges. Some of the areas or some of the states like Andhra Pradesh, Haryana, Himachal Pradesh and so on have introduced a 2-child norm policy for eligibility to contest an election at the local level. Similarly, we see the dominant group sometimes suppress the SCs STs or the weaker section or the minority sections. So those are some of the issues that we need to address. On the health front, India is having an MMR or maternal mortality rate of 130. So we are working in line with the Millennium Development Goal, where we talk about reducing the MMR by 3/4 between 1990 to 2015. So that was our goal. Now maternal mortality talks about the issues related to management during pregnancy, childbirth, termination of pregnancy and so on. So that's something that we need to focus on. However, there are various states which have achieved a significant drop in the maternal mortality rate. Those are Uttar Pradesh, Uttarakhand and Assam. So the name of these states become really important, mainly for your prelims examination. For your mains, as we said, you can substantiate it with your core answer writing, bring in more case studies. So emergency response system again becomes very important. You have the emergency response system with the PHC, CHC and the first referral unit. So at each of those levels, developing a proper infrastructure, bringing in more auxiliary midwives is some of the major developments that has been seen. We are working towards a continuum of care approach, so strategic approach for the maternal, neonatal child care and adolescent care, bringing in supplements and nutritional supplements for the common people. Talking about the tracking facilitation centers for mother and child, the various tracking systems, the IT enabled healthcare system that has been released. Along with that, you have other schemes that have come up, mainly in the terms of scholarship. The aid that is being provided to our common people is through DBT or the direct benefit transfer, going directly into the bank account. So there is much more transparency and accountability in terms of the amount that is being provided to an individual. Similarly, for the education, you have the Disha scheme that has come up. You have the daycare facilities that is being provided mainly to the people with disabilities for the 4 hours in day, along with the age specific requirement. And then you have the various counseling activities that are mainly for the daily living that is being provided to the parents and the guardians of an individual. So with this we cover the Yojana August 2018. We'll be covering the further topics in the upcoming months. So stay tuned for a monthly update on these topics. Have a great day ahead.